guys, welcome back. Hopefully you've just been to see our latest video, which is the chest pain consultation video. Now we're going to do a post-video analysis whereby we're going to break down that consultation and try to give you some feedback on things that you should be looking at doing and all the different domains you should be looking at hitting. Broadly speaking, medical exams, OSCEs at different levels have slightly different angles and focuses. But broadly, there are three domains that an examiner will be looking at marking you, which are data gathering, clinical management skills, and interpersonal skills. So we're just going to break down that consultation into those three categories, and Waheed's going to start us off now.
So the first one, data gathering, that essentially involves history taking, examination and investigations. Now, let's go to the beginning. So in terms of history taking, one thing I'd always say is make sure you start off with open questions. So essentially, you obviously after you've introduced yourself, you start off with open questions. That gives the patient time to tell you everything, to tell you their story. And often there's something called the golden minute in medical history taking, and that's usually the minute where you let patients tell you about exactly what's going on, what's brought them to the doctor, and they tend to tell you what might be concerning them as well in that initial minute of the consultation. Now, in terms of structure, so here it became quite apparent from early on was that there was a pain history to be taken. Now, one of the things that you can use, a tool that you can use, a mnemonic, and I wouldn't say just use this for the exam, or to learn this before you have any exam and practice it, is something called Socrates. Socrates, or any other type of mnemonic that you can remember that works and covers most of the essential parts you need for a pain history. So site, onset, character, radiation. Now we have done a video on Socrates, which you can find on our YouTube channel. But also, Socrates has to be used in the context of a history-taking model. So we tend to use the Calgary-Cambridge model. So that's presenting complaint, history of presenting complaint, medication history, past medical history, medication history, allergies, past surgical history, and social history as well. So in this situation, you wanted to establish, and I would recommend this for most histories, is always think in your mind, in the background of whilst you're taking the history, think about red flags. And before you enter any examination room or any examination station, and you're given the initial bit of the station, think in your mind, before you go in, you should always in your mind think, what are the red flags here? What could this station be about? So you're already thinking before you go in that these are the things I need to talk about. And it's hard under examination conditions. Sometimes you're under a bit of pressure, and to think of all those things that you practice for, and that you practice all these stations that you practice about. Start thinking and having a method almost about how you're going to tackle that station even before you go in the reading time. So red flag. So you want to establish here in this history that is symptoms getting worse? Is this acute chest pain, or is this something else? Could this be a respiratory cause? Could this be other causes? But it's quite clear from the history that actually this is angina. And you can establish that. Now there are, there are studies out there that say 80% of the diagnosis is actually history. If you take a careful history, so you should be getting to the diagnosis once you've taken the history before you get to examination. Now, examination in this stage was all normal. You had normal blood pressure, normal chest sounds, normal heart rate, normal oxygen levels. So the examination here didn't actually add much other than this wasn't an acute presentation of something. And investigations-wise, it's a chest X-ray, is additional things that could potentially have been also discussed is potentially an ECG, but it isn't always undertaken in primary care, but ECG is the other thing that should be potentially looked at, and also potentially blood tests as well.
Yeah, okay. Completely agree. So the next category that we're going to, or the next domain we're going to look at is clinical management skills, which starts with diagnosis. Waheed very quickly latched onto the fact that this was stable angina. He told the patient, he communicated the diagnosis, and then he went on to explain what angina is in layman's terms. Now this is extremely important, because when you explain a condition to a patient in simple terms that they can understand, they are much more likely to feel involved in the management plan, to feel involved in ownership of their condition, which means drug concordance goes up. Things like if you're trying to get them to quit smoking and take up more exercise, they're more likely to do these things because they now understand the benefits for these, as opposed to feeling like they're just being lectured for the sake of it. So explaining the diagnosis is a really key part, and using simple plain English is also very important in this situation. In terms of formulating a management plan, where he discussed with the patient that he'd like to start him on a nitrate, again explained why, what the point of the medication was, and how this would help the patient with his symptoms. This again is likely to improve medication concordance.
I would say one of the things with medications as well is that if you explain side effects or common side effects to patients as well, so when they get them and things to look out for, often you find that the side effects, and lots of medications do cause side effects, is that they're less scary then for the patients. They're less worried in terms of, if the doctor said that this might cause symptoms, then the patient's going to be less concerned when they do occur. And they also know when to contact you as well. That's important in safety netting, which is an important part of medical practice.
Absolutely. And the third domain we're going to be touching on is the interpersonal skills. This is a really important part of your clinical station. The reason being, firstly, you have to remember the person sat opposite you, yes, they're an actor, but they're also still a human being. And you will, inadvertently, when you are communicating anything with a patient or an actor, you will develop a rapport and a relationship. And if you develop a good relationship with that actor, they are more likely to volunteer information. If the consultation feels strange or strained, difficult, if they feel like they're not being listened to, there will be an unconscious bias in giving you less information and not helping you out as much as they would otherwise.
So it's like a flow, essentially a flow of the consultation. So if it's a jagged start-stop consultation, that's not going to flow. So if say for example cues, so the actor or the patient gives you a cue, you then respond to that cue. That will help build rapport. It will help build that relationship between you and the patient.
And the patient is giving you that cue for a reason. It is important. So he's or she is trying to give you a piece of information that you may not have picked up on yet. So when they say, "Oh, I've had a bit of discomfort here as well," pick up on that, because that means this isn't an asthma station. Actually, maybe this is more of a chest pain station. Maybe you were going down the wrong route. So really be mindful of what the patient is telling you. In terms of developing rapport with the patient, we have done a video on this on our channel as well. If you have a look, scroll through our videos, you'll find a very nice video on how to develop rapport with a patient. Now, interpersonal skills also look at the use of open questions, which I think Waheed already mentioned in the golden minute. Rather than saying, as opposed to saying things like, "Do you have any pain?" That's a yes or no question. That's a closed question. If you say, "Where is your pain?" that is an open question. So the patient can't respond in a yes or no fashion. You're inviting them to expand a bit more on what they need to say. Giving a yes or no question, you won't get much out, just a one word answer potentially.
And even things like, tell me a bit more about this, tell me a bit more about your pain, or tell me a bit more about how you've been feeling if it's another station. Obviously in this case it's a chest pain station, but often, but just by saying those sorts of phrases like "tell me a bit more about it," this again, it's that golden minute rule here is where patients will be far more likely to tell you what's on their mind. Sometimes they might tell you about what's concerning them, what their ideas are, which obviously within the interpersonal skills you have to try and touch on ideas, concerns and expectations. Now, one of the things with ideas, concerns and expectations, again, that has to be, with building rapport, it has to be natural as much as you can make it natural, but they may not come in that order. So it may be that someone at the very beginning, within the first few minutes, is telling you what they expect from being here, and then it's only the concerns come out at the end. So have a flexible approach to this. That it may not be exactly the same order. Sometimes you have to respond to cues first, see where they're leading to, and then continue with the structure that you've got. And that essentially comes through practice. History taking is a skill, and it's a skill that you have to develop. And the more you practice, the more stations you do, the better you're going to get at it.
Absolutely. I think that pretty much covers all three domains and gives you a brief summary of how we would look at breaking down a station, and also if you attend one of our courses, how we would give you feedback on your performance in each case. It would be individualized feedback like that. So if there are any particular subjects or topics that you find difficult consulting on, drop them in the comments below. We'll have a think, and we'll see if we can do any more videos on specifically consultations for you guys as well.
See you next time.